Hey, health enthusiasts! Are you aware of the impact vitamin B12 deficiency can have on your health? Let's discover why vitamin B12 is absolutely crucial for your well-being. Vitamin B12, also known as cobalamin, is essential for various bodily functions, including DNA synthesis, red blood cell formation, and neurological function. While the importance of this vitamin is well known, a surprising fact about vitamin B12 deficiency is its potential to cause severe neurological and psychological issues, often before any signs of anemia appear. This delayed presentation can lead to misdiagnosis and prolonged suffering if not promptly recognized. The silent impact on mental health. Vitamin B12 deficiency can masquerade as several psychological disorders. Patients often present with symptoms such as depression, memory loss, irritability, and even severe psychiatric disorders like paranoia or hallucinations. These symptoms can be particularly insidious because they might be attributed to other causes like aging, stress, or mental health conditions, leaving the actual deficiency untreated. This delay can lead to irreversible neurological damage if the deficiency persists. Neurological consequences. Beyond psychological symptoms, vitamin B12 deficiency can cause significant neurological impairments. It can lead to numbness or tingling in the hands and feet, difficulties with balance, and even cognitive decline, which might mimic conditions like Alzheimer's disease. These symptoms result from the vitamin's role in maintaining the myelin sheath that insulates nerve fibers. Without sufficient B12, myelin degeneration occurs, leading to nerve damage and its associated symptoms. Hidden causes of deficiency. While a strict vegetarian or vegan diet is a well-known risk factor for B12 deficiency, as the vitamin is primarily found in animal products, there are other less obvious causes. Conditions such as pernicious anemia, an autoimmune disorder affecting the stomach's ability to absorb B12, gastrointestinal surgeries, and chronic use of medications like proton pump inhibitors, or metformin, can also significantly reduce B12 absorption. Aging itself can decrease stomach acid production, further impairing B12 absorption in the elderly population. How important is vitamin B12 for our overall health and well-being? Vitamin B12, also known as cobalamin, is an essential water-soluble vitamin that plays a crucial role in maintaining overall health and well-being. Here are some key points highlighting its importance. Number 1. Red blood cell formation. Vitamin B12 is vital for the production of healthy red blood cells. It helps in the synthesis of hemoglobin, the protein in red blood cells that carries oxygen throughout the body. A deficiency in B12 can lead to megaloblastic anemia, a condition where red blood cells are larger than normal and not fully developed, causing fatigue and weakness. Number 2. Neurological function. Vitamin B12 is essential for the maintenance of the myelin sheath, a protective covering around nerves that ensures the proper transmission of nerve impulses. Adequate levels of B12 help prevent neurological disorders, cognitive decline, and mental health issues such as depression and memory loss. Number 3. DNA synthesis. Vitamin B12 plays a critical role in the synthesis of DNA, the genetic material in all cells. This function is particularly important for rapidly dividing cells, such as those in the bone marrow and gastrointestinal tract. Number 4. Energy production. Vitamin B12 is involved in the metabolism of every cell in the body, particularly affecting DNA synthesis and fatty acid and amino acid metabolism. It helps convert food into glucose, which is used as energy, thereby preventing fatigue and low energy levels. Number 5. Heart health. Vitamin B12 helps regulate levels of homocysteine, an amino acid in the blood. Elevated homocysteine levels are linked to an increased risk of heart disease. B12, along with folate and vitamin B6, helps convert homocysteine into methionine, thereby reducing the risk of cardiovascular issues. Number 6. Mood and mental health. Vitamin B12 is involved in the production of serotonin, a neurotransmitter that affects mood. Adequate levels of B12 can help maintain mental health and prevent conditions such as depression and anxiety. Number 7. Bone health. There is evidence that vitamin B12 plays a role in maintaining bone health. Low levels of B12 have been associated with decreased bone mineral density, which can lead to conditions such as osteoporosis. Exploring the common causes of vitamin B12 deficiency. Despite its importance, vitamin B12 deficiency is relatively common, affecting a significant portion of the population. This article delves into the primary reasons behind the widespread occurrence of vitamin B12 deficiency, focusing on diet choices, age-related factors, and medical conditions. Vegetarian and vegan diets. People who follow vegetarian or vegan diets are at a higher risk of B12 deficiency. Plant-based foods do not contain significant amounts of vitamin B12, making it challenging for individuals on these diets to meet their nutritional needs without supplementation or fortified foods. Poor dietary intake. Even among those who consume animal products, poor dietary choices or lack of variety can lead to inadequate B12 intake. For instance, individuals who rely heavily on processed foods may not get enough of this essential nutrient. As people age, their risk of vitamin B12 deficiency increases due to various physiological changes. Reduced absorption. Older adults often experience a decrease in the production of stomach acid and intrinsic factor, both of which are necessary for the absorption of vitamin B12 from food. This reduced absorption can lead to deficiency even if dietary intake remains consistent. Dietary changes. Elderly individuals may have decreased appetites or difficulty chewing and swallowing, leading to reduced consumption of nutrient-rich foods, including those high in vitamin B12. Medical conditions. Certain medical conditions and treatments can also contribute to vitamin B12 deficiency by affecting absorption, metabolism, or intake. Gastrointestinal disorders. Conditions such as celiac disease, Crohn's disease, and atrophic gastritis can damage the lining of the stomach or intestines, impairing the body's ability to absorb vitamin B12. Surgical procedures that remove parts of the stomach or intestines, such as gastric bypass surgery, can have similar effects. Pernicious anemia. This autoimmune condition leads to the destruction of stomach cells that produce intrinsic factor, a protein essential for B12 absorption. Without intrinsic factor, the body cannot effectively absorb vitamin B12, leading to deficiency. Medications. Certain medications can interfere with B12 absorption. For example, long-term use of proton pump inhibitors, PPIs, and H2 receptor antagonists, commonly used to treat acid reflux and peptic ulcers, can reduce stomach acid production, hindering B12 absorption. Metformin, a medication for diabetes, can also affect B12 levels. Chronic alcoholism. Alcohol abuse can lead to poor dietary intake, damage to the stomach lining, and impaired absorption of nutrients, including vitamin B12. Chronic alcoholism is, therefore, a significant risk factor for B12 deficiency. Genetic factors. Some individuals have genetic mutations that affect the proteins involved in vitamin B12 absorption and metabolism. These genetic variations can lead to a higher risk of deficiency even with adequate dietary intake. Ensuring adequate intake of vitamin B12, dietary sources, supplements, and medical treatments. Vitamin B12 is crucial for many bodily functions, and maintaining adequate levels is essential for overall health. Here are various ways to ensure sufficient intake of this vital nutrient. Dietary sources. Animal products. The most natural sources of vitamin B12 are animal-based foods. Including these in your diet can help maintain adequate B12 levels. Meat, beef, pork, and lamb are rich sources of B12. Fish and shellfish. Fish like salmon, trout, and tuna, and shellfish such as clams and oysters are excellent sources. Poultry, chicken and turkey also contain significant amounts of B12. Dairy products, milk, cheese, and yogurt provide B12. Eggs, both the yolk and the white contain vitamin B12. Fortified foods. For those who do not consume animal products, fortified foods can be a valuable source of vitamin B12. Breakfast cereals. Many cereals are fortified with B12. Plant-based milks. Almond, soy, and rice milks often have added B12. Nutritional yeast. This product is popular among vegetarians and vegans and often fortified with B12. Supplements. Oral supplements. Vitamin B12 supplements are widely available in various forms, including tablets, capsules, and sublingual under-the-tongue forms. These are particularly useful for vegetarians, vegans, and older adults. Multivitamins. Many multivitamin formulations include vitamin B12. This can be a convenient way to ensure intake of not just B12, but other essential vitamins and minerals as well. B12 lozenges and gummies. These can be an alternative for those who have difficulty swallowing pills. B12 sprays and drops. These are absorbed directly into the bloodstream through the mucous membranes in the mouth, offering another option for supplementation. Medical treatments. Intramuscular injections. For individuals with severe B12 deficiency or absorption issues, healthcare providers may prescribe B12 injections. These are typically administered intramuscularly and can quickly elevate B12 levels in the body. Nasal sprays. Vitamin B12. Nasal sprays are an alternative to injections, providing an effective way to increase B12 levels, especially for those who have trouble with absorption through the digestive tract. Lifestyle and dietary considerations. Regular monitoring. Periodic blood tests to monitor B12 levels can help ensure that you are maintaining adequate levels, particularly if you are at risk of deficiency. Dietary planning for vegetarians and vegans. Those following plant-based diets should plan their meals carefully to include fortified foods and consider regular supplementation to prevent deficiency. Addressing underlying health issues. If you have medical conditions that affect B12 absorption, such as gastrointestinal disorders or pernicious anemia, work with your healthcare provider to manage these conditions and ensure adequate B12 intake through appropriate treatments. The impact of vitamin B12 on energy levels, brain function, and overall well-being cannot be overstated. It is essential for maintaining a healthy metabolism and supporting cognitive function. Maintaining adequate vitamin B12 levels is essential for overall health. By incorporating rich dietary sources, considering supplementation, and addressing any underlying health conditions, individuals can effectively manage their B12 intake. Regular monitoring and consultation with healthcare providers are also important to ensure optimal vitamin B12 status and prevent deficiency-related health issues. I encourage you to take charge of your health by checking your vitamin B12 levels, incorporating B12-rich foods into your diet, and staying informed about the importance of essential nutrients like vitamin B12. So, what do you think? Have you been paying attention to your vitamin B12 intake? Drop your experiences in the comments below. And if you want to learn more about other essential vitamins that can supercharge your health, don't forget to check out our other videos. Stay healthy, and I'll see you in the next one. Don't forget to subscribe for more health-related content to stay on top of your wellness journey. Share this video, and remember, sharing is caring.